Welcome to the Nurse Residency Program, Searching the Evidence. This is your evidence-based practice module. I'm Dana Bush. I'm a clinical education specialist with the System Education Department. I'm a level of care educator for the emergency department. Our outcomes for this module are participants will indicate an increase in knowledge of key concepts, draft a PICO question, utilize available resources, and critically appraise research studies. The disclosure slide. So I have nothing to disclose as the presenter. To complete this course, you have to attend the entire program and do the evaluation. You'll get 3.5 contact hours, and they're awarded from the Midwest Multi-State Division Department. Let's talk about our outline of what we'll discuss today. What is evidence-based practice? What are the steps? What are some models? What are some barriers? How do we look at evidence? And what should we do next? Have you ever thought about there's a difference between research and evidence-based practice? So research really is focusing on discovery or investigating or finding new information, where evidence-based practice focuses on applying that research to practice. Let's look at it a different way. What is evidence-based practice? It's clinical expertise, best research evidence, also patient values and preferences. Here are some evidence-based practice nurse residency projects that I'd like to show you.
So my NRP project was the post-op bilious prevention. It is now an order set. Basically, it is an order set for patients that have had certain types of surgeries to chew gum after the procedure when they're back up on the floor. And it helps prevent post-op biliuses by helping them pass gas faster, have a quicker bowel movement, reduces their stay in the hospital, and improves patient satisfaction. We are now still doing research on if it is impacting the patients that are chewing it versus the ones that aren't. As a new grad working on the project, we had to go through the whole process of getting it approved since it was going to be an order set. So we started with the physicians and then went to the evidence-based team. We did all the research for it, and it was eventually added into an order set for several different surgeries. So it's something that I worked on as a new grad 4 years ago, and I still am working on it and see the changes throughout the system. And it's awesome to see the order set on the patients that I take care of.
Our NRP project is an emergency department aggression rating tool. We call it the EDART.
Yes.
It is a tool that we help assess and score our agitated, combative, maybe high, maybe drunk, emergency department patient. That we found a tool was for an ICU that was being modified, or a tool for an service was being modified. Not only did we find that there wasn't a tool for a specific population, there wasn't one in this hospital or another hospital or any hospital in America. So we're hoping to get not only this part of St. Luke's, like a tool to be used in St. Luke's, but hopefully around emergency departments everywhere.
The goal with it, we provided interventions for nurses to quickly recognize those symptoms or those behaviors and intervene to prevent escalating behaviors and reduce people going in restraints and increase safety for patients and nurses and all of the staff.
Yep.
Yes. How many people did you say there had been?
There'd been like 1,000, I don't know, it was like 1,300 activations.
Of either 2 or higher?
Of 2 or higher.
Okay.
Security had to come wand 57 of them.
Okay.
And only one of those people were in restraints.
That's awesome.
Yeah.
I never dreamed and didn't realize that so many different departments were involved in changing something that just involved one department. Like we're in the emergency department, and what we're wanting to do is for the emergency department, but we had to involve security and legal and regulation and research. And I would have never dreamed that all of that would be involved in process of change.
Wasn't just nurses.
No. We work as a team.
Yeah,
All
'cause I'm like,
society.
Just refreshing you.
exhale.
Okay.
We initially started with urinary retention and using peppermint oil to not prevent, but help urinary retention. And
We actually found that there wasn't enough research on that topic, so we had to broaden our horizons and do just like essential oils in general. But there is potential for us to like complete research in the health system with peppermint oil and other essential oils.
Yes.
Yes.
Let's talk about the steps of your evidence-based project for your nurse residency program. First, you're going to ask a question. So you ask questions like, why do we do it this way? Then you're gathering your team, and then you have to write a PICO question. You have to create a plan or timeline, brainstorm, search the evidence, read and evaluate the evidence, summarize your evidence, and determine the recommendations, as well as find a method to implement it. So we're going to talk about each one of these steps today. First, let's talk about what your presentation will look like, because you'll need to present this information as your final project for your evidence-based practice in your nurse residency. So your outline, we have an outline created for you. It's a skeleton PowerPoint, and the PowerPoint is labeled Slide 1, your topic and your group. Slide 2, your PICO question. Slide 3, 4, 5, 6, and 7 are your articles. Slide 8 is going to be your recommendations for change. Slide 9, next steps, like how would you implement it? Slide 10, you always have to say, do you have any questions? And if you do, who do we contact with those questions? And then your last slide is going to be your references. So first, let's talk about a PICO question. What is a PICO question? Some of you might already know, but we need to go over that together. P stands for population, or it stands for people. Who are we talking about? Who are we focusing on? I is your intervention. So something new you're going to do with this population or group of people. C is comparison. So you're comparing it to what you're currently doing. And O is your outcome. So if you do this new intervention, what will be the outcome for that population or those people? Now, some people add a T for time. When would this take place? Let's practice a PICO question. So I'm going to give you some information, and what you'd have to do is think about it. You'd have to look to the literature and look for articles, read several articles before you come up with a recommendation. That's how we do the evidence-based practice. Here's an example. Have you ever thought about why do we stand when we're doing patient care, or should we sit when we're doing our patient care, when we're with our patient? We're taught in nursing school that we should sit eye level to the patient, but does it really make a difference? So you would have to look in the literature and see if you can find any kind of research articles from different directions, positive and negative, about patient care with sitting and patient care with standing. So we looked through the literature and we actually found that patients believed, in a research article, patients believed that the nurse was with them longer when they were sitting. So as a group of residents, you might recommend sitting while you're doing your initial assessment with your patient or your initial interview with them. So your PICO question might look like this. Population, hospital patients. Interventions, sitting while talking to the patients within the first 60 minutes of patient care, compared to standing at all times while in the patient's room. And your outcome would be improved patients' perception of quality of care. The research actually shows that patients believe they had better quality of care when the staff sat down within the first hour of taking care of them. It made them feel like they were cared for. In your small groups, we have a few different articles that you're going to be able to practice writing PICO questions with your clinical education specialist. I want to show you an example. So let's use that EDART, and let's go through the example of their PowerPoint so you can see what it would look like. So they start out with their name of their project. right here. And they actually had another slide right here where they had the names of the people and they gave a scenario for, like, imagine this. And they described what it was like to have a patient in the ER with acute behavioral disturbances. Glad that's over with. Then they went into a PICO question. So their population was patients with acute behavioral disturbance in the emergency department. The intervention was use of a behavioral assessment tool compared to use of inpatient Riker score in the emergency department. And the outcome was to improve staff and patient safety and decrease staff violence. So they went through the different articles and they discussed it. See if I can move this down a little bit. There we go. And they just really highlighted what was in the article. So they did it with some bullets. You want it to be large print, but they talked about here evidence of violence in the emergency department. So they painted a picture of what violence looks like in the emergency department. And that last bullet, 67% of nurses involved in the study rated their safety in the ED a 5 on a 0 to 10 scale. 1/3 of these nurses have thought about leaving due to violence. That really speaks volumes to the emergency department. Pay attention at the bottom where we have the levels of evidence. We're going to go over these levels of evidence together, but notice that every time you present an article, you need to have at least the article's level of evidence. So in this case, it's a C. And then you're going to have the year and either the article's name or the author's name so that we can relate this back to the reference sheet. Here's the next one. Here they have an article describing what the Riker sedation agitation scale is. That's what they were currently using in the emergency department. So it was used to measure the appropriate level of sedation in ICU. That really does not fit with the patient that comes in that's drunk or high. So they described what that tool is like and why it did not fit in our population. I'm going to bring this down so you can see. Here's their reference right here, St. Luke's Practice, Modified Riker Scale. So they actually used our information within our own system. So going back, the next article they presented was articles on describing violence. And so what are the behaviors that people have that are violent in the emergency department setting? Notice how they put the reference right there. The next one they have is Sedation Assessment Tool to Score Acute Behavioral Disturbance in the Emergency Department. This one, they talked about an SAT score, but it was used in Australia and is only going from a +2 or 3 to a -2 or 3, and it wasn't very reliable. But that was the only thing they could find within all of the articles that they reviewed. Notice they put the level of evidence as a B and the author and the year. Here was the sedation assessment tool that was within that article that they pulled up from the internet. Again, it came from the Australia, Emergency Medicine of Australia, and this is what it looked like. And what they seen was it still could be very subjective on your assessment of that patient. Level of evidence was B, and it showed the resource. Their recommendations were to either adopt the SAT assessment tool from Australia or create their own emergency department specific behavioral assessment tool, which they did. They had to put a slide with questions. In your case, you'll put the slide with questions and give email addresses on where people can ask questions from. This presentation was actually a live presentation. And then here's their references. So if someone was looking at this PowerPoint and they wanted to know more about each one of the articles, they can look at their reference sheet and actually find it themselves. Now let's hear from some nurse residents that have already graduated and see what kind of advice they have for you.
Pick a project that you can take further. Don't be an autopilot.
Pick a project that you really care about, something that you're going to be invested in, and be prepared to be patient.
I would say that you find something that you're passionate about. and that's going to keep your interest, not just during the process of doing the project, but even afterwards if you want to carry it out and get it put into practice.
To get together with the group and just come up with questions and answers, and because it doesn't take only one person to come up with what's best. It is wherein a lot of nurses come together and give their input.
My biggest advice would be to start early. Don't procrastinate. Talk with your peers, even if it's just kind of like throwing out ideas you don't know might have enough information. And that's the benefit of starting early. You can, research a little bit to see the amount of information that's out there. And if you need to change your idea, then you've got enough time to do so.
I would probably say don't procrastinate. It's easy to just like make a list of the things you need to do and, divide it up with your group and make sure everyone is on the same page about it. And it doesn't take too long to do that, so.
I would find some research, make sure that you have enough research to support what you're talking about.
Now we're going to talk about the barriers to evidence-based practice. One of the barriers is lack of knowledge about evidence-based practice. Individuals don't know how to complete a literature review or find literature. Research articles are challenging to read and review. Time to research and implement the evidence-based practice. Not knowing how to navigate the evidence-based practice process. Are you ready? We're going to go through the steps that we talked about on an earlier slide on the entire process on how to do an evidence-based project. We start with ask the question. So if you ever find yourself saying to yourself, why do we do it that way? Then you go and you ask your preceptor, or maybe you ask your coworker, why do we do it that way? And they say, oh, that's the way we've always done it. That would be your first clue that maybe we need to go look at the literature and see if this is the best practice for our patients. So here we go. We're going to gather our team. So in nurse residency, your nurse resident, someone in your nurse residency program is your team. But throughout your nursing program, throughout your nursing profession, you're going to be making changes by looking at evidence, and you're going to want a team. So your team could be your educator. Your team could be your manager, or somebody in quality, or shared governance, or somebody in upper leadership, or somebody outside of your nursing program, outside nurses that aren't just part of St. Luke's. Then you're going to create your PICO question. So your PICO question is going to be your population or your people. You're going to have to define who they are. You're going to have your intervention. So what are you going to do that's new based on the literature that you reviewed and compared to what you do now? And then what is the outcome? So remember, the outcome needs to be measurable. How will you know that there'll be a change? How do you know it makes a positive change? So you'll have to have an outcome that's measurable. We'll need to look at some models for evidence-based practice. The Iowa model is an evidence-based practice process. You'll get a handout so you can read through it as a group, read through each one of those boxes and decide whether it's whether your project is worthy of going through the research and making a project for it. So that's one model. There's actually like 47 different evidence-based project models in the literature. So we're going to talk about another one. The ACE STAR model of knowledge transformation. It's designed to be very, very simple. However, it's very comprehensive. So the first step, step one, discovery, it represents primary research studies. So what's in the literature? Number two, summary. So it synthesizes all the available knowledge. 3, translation into action. So we call that sometimes evidence-based practice guidelines that we create. 4, practice integration. So how do we align best practice from the evidence into our current practice now? And then 5, evaluation. What is the impact of this evidence-based practice on patient outcomes? This model right here doesn't have to start with level 1, and then 2, and then 3, and then 4, and then 5. You actually can start at any part, and you can go in any direction. So maybe you look at your guidelines first, and once you look at the guidelines, you want to see, well, the guidelines are about 3 years old, what's in the evidence now? So you could go backwards to number 2, go from number 3 to number 2, look at the evidence, and maybe there isn't anything new. You might even want to do your own research and go to number 1, where you actually discover new things. If there's research out there, we could start with 2 and then move to 3. So ideally you would move in the 1, 2, 3, 4, 5. However, you can jump on this at any point and go in any direction, with the last step being evaluation. Is it working for us? That's why this is a simple model, but yet comprehensive. Then we go on to planning. So I recommend that you start planning today. So you should make a timeline. This is my recommendations. Make a timeline of when your project is due, which I will go over the due dates here shortly, and then work backwards. Maybe somebody in your group can be the leader, and they can set up timelines of when things will be due and hold everybody accountable. Maybe you guys can just agree on it's okay if this person reaches out to us and checks up on us to see if we have our items done, or our literature reviewed, or our PowerPoint slide completed. So planning is very important. Brainstorming. So brainstorming is a part where you start looking at every term. So maybe you want to talk about the Volt phones. So if you want to talk about phones, there's so many words for phone, and when you're brainstorming, you might say electronic device. You may say cell phone. You could say recorder. There's just so many things that you could use for the word phone. If you were going to look up, do Volt phones really help with patient care? That's just an example. So when you're brainstorming, try to be very supportive of anyone else, because that's where the greatest projects come out, is people just start talking in their small groups and brainstorming different ideas, different concepts, questioning different things. It should be an area where you can freely express things that you would like to investigate. Once you decide on your topic, then you have to search the evidence. So we do all kinds of things to look for literature. So we have EBSCO and CINAHL, Medline, the Cochrane. Those are things that a lot of the medical people use to search for literature. You have Ovid and PubMed, and we have UpToDate and Lexicon, but their biggest resource are the librarians. The librarians have their own icon in Citrix, where you can click on this Health Science Library, and it tells you all about the library, and it also gives you information on how to contact them. You can contact the library with it using their email address, written right here on the screen, slhslibrary@st-luke's.org. Send the library your ideas. Say, I'm looking for literature on the sitting versus standing concept. But more than that, you want to tell them the entire idea. They are not nurses, and so they may not use terminology that you use. They may not know or understand what it is you're looking for, but the more information you can give them, especially a PICO question, the more information you can give them, the better they are at giving you information. Then the library is going to send you a list of articles. So they're going to email you a list. I put an example right there. This is just the first 6 articles, but that particular list that they sent me had 42 different articles. You're going to read through the names of these articles, maybe the year, and try to figure out which articles you would like to read. They don't send you all 42 articles in its entirety, but they will choose. If you say, I want articles 3, 4, and 5, then they will get the articles for you and send them to you in an email. And if later on you're like, I would like articles 10, 12, and 17, then you can always add to that list of articles. Just make sure you send this reference list with them, because they do this for people every single day, multiple times. So once you get your evidence, which could be around 10 articles, you're going to read them and evaluate them very carefully. So you're going to look at the levels of evidence. So how strong is this evidence? At St. Luke's, in our nurse residency program, we use the American Association of Critical Care Nurses levels of evidence to rate our evidence. I'm going to give you some examples and explain them to you. So the levels range from A to M. Before I get into the definitions, here's a pyramid that is used to describe them as well. So A being the strongest level of evidence on the top. So A and B are experimental, so they're at the top. and then you have C. It's the next strongest. And then you go towards D, E, and M is the weakest level of evidence. So using this pyramid gives you an idea just by looking at it, which one is the strongest. The one on top, level A. Level A is either a meta-analysis or meta-synthesis. So meta-analysis, quantitative studies. So multiple research articles were looked at and analyzed and then put into one big summary. That's what that is. So it wasn't just one researcher's idea or one small group of researchers' idea. It's several from different areas. So meta-analysis is the strongest. And if you want a meta-analysis of your topic, then make sure you tell the librarians that you would like to see if there's a meta-analysis available, or a meta-synthesis. Meta-synthesis is qualitative study, or meta-analysis is quantitative. I have put an example at the bottom. If you have an article that is a level A evidence, then I want you to put at the bottom of your slide, level of evidence A, and then put the name of the article and the year. We want you to put the level of evidence A through M to see if you're able to actually put the level out there. But we want the article's name, so it also helps make that decision. Here's the level B. Level B is a randomized controlled trial. So RTC is what they're called sometimes. And it should say that somewhere in the article that it was an RCT. So it's well-designed controlled study with consistent results. Whether it's randomized or non-randomized, well-designed controlled study. So you have a control group and a non-control group. So it's an experimental. Random assigned to groups. It reduces the potential for bias. So look at the bottom where I have a level of evidence, B, and then I have a name of an article. It's called Randomized Controlled Trials of Interventions to Improve Communication in Intensive Care from 2011. When you get to your reference page, it'd be easy to find the rest of the information from that article. But that's an example of a level B. Level C evidence. It would be qualitative studies. They're descriptive or correlational studies. It could be integrative review or systematic review. It could also say randomized controlled trial without inconsistent results. I put an example at the bottom. If you had an article and you were going over it and it was a level C, I'd want you to put level of evidence C, satisfaction with nursing education, job satisfaction, and work intentions of new graduate nurses in 2016. Again, when we look at your reference page, it'd be easy to find it. Level D, peer-reviewed professional organization standards with clinical studies or support recommendations. So you need to look for research that informed the guidelines or standards. For example, American Heart Association has guidelines on how to do CPR. We don't go and look at the evidence, the research articles that the American Heart Association talks about. We understand that as a professional organization, they have looked at this whenever they provide guidelines. Another example is at the bottom. Level evidence D, professional organization, the Emergency Nursing Association in 2018 recommended something. So that was someone recommended, they put this on their slide and they just put that at the bottom that's where they got it from and that's the year that the recommendation was made. Level E evidence. So it could be case studies or it could even be one case study that showed an outcome. It could be an expert opinion. It's usually in peer-reviewed professional organizational standards without clinical studies or supportive recommendations. So an example at the bottom says level of evidence E. And the title was The Novice Nurse's Guide to Calling Code Blue from 2014. So it's actually an article that a nurse wrote that she felt like other nurses needed to know. So it was really her opinion. So expert opinion. The last one is level M. So we went from A, B, C, D, E, and then we went to M. The reason we went to M is because it's for manufacturer's recommendation. It's considered the lowest level of evidence because it probably has some bias. It's usually they're trying to sell a product or they're trying to support the use of their product. So it could be their guidelines. For example, at the bottom, I have level of evidence M, Alaris. So from our Alaris pumps, Alaris System User Manual, and then it has the version of the manual and the year that it was published. So maybe you're talking about something with the Alaris pumps that you want to discuss, and it's okay to put your level of M evidence in there where you got this information, but it should not be by itself. It should not be the only level of evidence. All of your levels of evidence should not be all level M, because it wouldn't be very strong evidence. When you do your breakout sessions, I've created some articles that you can analyze together as a group and have discussions about it. I think they're pretty funny articles. Another thing in your handout that you can use when you're looking at your literature is a summary of the evidence. And so you can write down information as a team of what you found out in your different articles, because you might look at 30 articles before you decide on three to 5 articles to present in your nursing residence project. Then the last thing you're going to come up with is your recommendations. So based on the evidence, what are your recommendations from your group of peers? What are you recommending to change? Your recommendations could be that we are doing the best that we're doing. You know, you asked the question, you looked at the literature, and we really are doing evidence-based practice and doing best practice currently. So it's okay if that's the answer. We just want you to present the evidence and show it in your project. Now, once you get that done, you're going to have to make a PowerPoint with a voiceover, and you're going to have to publish it on YouTube in order to turn it in. So YouTube is the only method that will be accepted. You can't use TikTok or any other kind of recording. We only use YouTube. If you really need help, your clinical education specialist can help you get it onto YouTube. Implementation. So implementation of their project is not part of the evidence-based project. However, if you've done all this literature review and you found out there's a better way, why wouldn't you want to implement your project? Then you might be saying to yourself, how? How could I possibly implement a project that would go through the entire system? Well, luckily, we have a process at St. Luke's. It's called shared governance. So here's an example of the shared governance model at St. Luke's. So you have towards the bottom, you have different practice councils. So the emergency department practice council or critical care practice council, you have a list of them there. You might take your project to the practice council. Then there's other things that you could go to that are also one of those boxes. You could take it to the research council. You could take it to the CNO if you wanted to. Your clinical education specialist will help guide you on where to go in order to make implementation happen. The next thing that you probably want to know is when. When we're looking at our timelines for the project, when are these things due? So if you graduate nurse residency in January, your timeline is December 1st, your PICO question is due to Brenda Potter and your clinical education specialist. So you have approximately 1 month to get that in. And then your final PowerPoint that you do a voiceover recording and put on YouTube is due January 10th. It's best to get it done prior to that. If you graduate in June, and you're part of the June cohort of the nurse residency, you have till April 1st to get your PICO question to Brenda and your clinical education specialist. That gives you approximately 5 months, but don't wait. You should go ahead and get it in. And then your voiceover PowerPoint is due June 1st. Your last module for your nurse residency is called Graduation. So during nurse residency graduation, all of the presentations will be put out there for other people to look at and give feedback on. I want you to hear from Emily about an update on her EDART project.
So the Emergency Department Aggression Rating Tool, the EDART, is now system-wide. It's in all of the St. Luke's Health System emergency departments. What we're real hopeful for is after we've seen de-escalated patients, improved charting on those type of aggressive patients, that it will be coming to a department near you soon. Hopefully Med-Surg will be able to find ease with documenting on some of their more aggressive patients, as well as mother-baby. We're really excited that it's going system-wide. Nurse residency program rocks.
Let's also hear from the System Education Department.
Hey, St. Luke's nurse residents, Marcy Eberts from the education team. Just wanted to talk to you for a minute about evidence-based practice. I get it that maybe your EBP nurse research class in school was lame and sad and not your favorite. I get that. And maybe you're even dreading this EBP project that you're doing for your nurse residency. But no, don't dread it. this is what nursing is about, being this lifelong learner and always trying to improve. Can you imagine if we practiced nursing like our preceptor taught us to practice nursing? We would never be improving. I mean, imagine we would still be like shooing the expectant father out to the waiting room while the mother gave birth under general anesthesia, and we would be heavily sedating our ICU patients on the ventilator for their comfort. Yes, no, I mean, we may even be still like sterilizing bedpans and using them on different patients. Ew. Come on, guys. Use your evidence-based practice project as a time when you can improve not only your own career, but the careers of nurses in the generations yet to come. It can be that meaningful. So I hope that you can pick an EBP project that means something to you, that you can stick with and write it for a long time and help to improve the overall profession of nursing. That is heavy stuff, but you can do it.
The Evidence-Based Practice Project gives new grads an opportunity to comb through the research and actually look and see if the practice that we're practicing within St. Luke's is actually accurate within the evidence. And it gives them a chance to actually own their practice and potentially make a change if a change is needed, and gives them the tools to make that change.
Hi there. I really like the evidence-based practice module because I really feel like it helps nurses dive a bit more into the literature, and it helps nurses use their strengths within a group. So we all get to work with our strengths and learn where we work best in a group. Diving more into the literature, we get to discern what levels of evidence there are and how not all journal articles are created equal. And they all serve their purpose, and we get to determine which ones are the best for indicating practice changes. So I hope you guys enjoy this module.
I'm really excited for new graduates to have this experience with research at this level. It really, I think, emphasizes the importance of that at the bedside. So you're doing things in your practice that you understand, has that evidence and has that research behind it, so you know you're doing what's best for the patient.
Hello, my name is Jamie Luark, and I am the System Director of Education, the RMC, and the St. Luke's Health System Float Pool. Today I want to take a few minutes of your time to talk about why I believe evidence-based practice is one reason a nurse is a professional. While it is important to do the right thing, understanding why you do it and what the evidence is that supports the practice is critical in making decisions about the care you provide patients. You own the quality of your practice, and it is important you understand and evaluate that practice regularly. So you might say, how can I do this with everything else that I have to do? Here's some tips and activities that I would suggest that will help you practice in an evidence-based way. The first and probably most important is to ask questions. Don't just accept the answers that, well, this is the way we've always done it. I certainly do not want you to practice doing things the way I did when I first got out of nursing school. Second, look procedures up yourself. Don't just take what people tell you. Don't make their bad habits your bad habits. Belong to a professional organization. This will help you stay current with the new evidence about your level of care. Most of the time, belonging to a professional organization comes with a journal full of research articles. It's good spare time reading. Use the library that we have. We have a fantastic library staff. Anytime you're curious about something, have them do a quick literature search for you so you can get the current, most available evidence. Participate in any evidence-based projects you can. The more you do it, the more you learn and are able to recognize when someone is asking you to provide care without evidence support. And finally, participate in shared governance. And shared governance is the vehicle by which nurses have a voice in nursing practice. And it's very important at St. Luke's Health System that nurses have a voice clinical nurses have a voice in their own practice. Making a commitment to evidence-based practice is a career-defining decision that will impact whether this is a job or a professional nursing career for you. During the nursing residency program, we are giving you your first chance to make a difference as a nursing professional. Pick a topic that energizes you, something you wonder about, or something that you would like to change. Nurses make a difference at St. Luke's Health System. I hope you lean into this opportunity and help us to continue to be the best place to get care. Thank you and good luck.
This is the end of our large group evidence-based practice topic. Now you'll break out into your small groups. If you have any questions, make sure that you ask your clinical education specialist.